So we have, in principle, we have in the control, we have the correct treatment. We also have the proper diagnosis and the appropriate hygiene as the very important columns. And I just, without outlining all of these too much, we have worked out recommendations for diagnostic procedures that should cover this extended period of excretion in a litter, as opposed to the very short excretion of oocysts by single piglets. And oocysts are usually found between 5 and 7 and 11 to 13 days after infection, and this has to be covered by sampling. And unfortunately, the fecal score is only poorly related to oocyst detection. So we recommend 2 samplings per litter with several individual samples each that can be pooled to really reliably detect the parasite on a farm, at least before treatment is started. And fecal examination must be adapted to fecal consistency. If you do flotation, you will just find a fat plug at the top because there's a very high fat content in these greasy feces. So what we do is autofluorescence. We just do a smear, and then we can detect the oocysts by autofluorescence under blue light. So these are the current recommendations that we give to the labs, and the double sampling is definitely very helpful to reliably detect the parasite. Now, when we talk about optimized control, we do have good control when we apply toltrosreel, but it must not be applied too late. So animals that are already diarrheic or have already started oocyst excretion cannot be treated as effectively as those that are treated in the pre-patent period, because we have poor control over environmental contamination and recontamination. So oocysts will be around all the time if you treat too late. You have very poor control over the disease because of microbiota disturbances that actually happen at a rather early time point after infection, as we have seen, and it's the same for diarrhea. And another issue here is underdosing, because commonly, obviously, farmers, we have also seen this in our field study, farmers use the recommended dose for animals age 4 days for animals that are much older, and we all know how fast piglets are growing. So if you treat a piglet at 11 days of age with a dose for a 4-day old piglet, then you have the dose, and that, of course, is it can be ineffective, and it can also drive the development of resistance. We know this from other parasites as well. And optimized control needs to include, of course, treatment with toltrosreel, but also hygiene measures and effective disinfection with chlorocresols. They're not easy to handle, and they're fairly smelly, and it can also be slightly toxic. But this inactivation of the environmental stages is definitely key for interruption of the life cycle long term. So basically, we have like Batman and Robin combination between chemometaphylaxis and inactivation. Management factors include colostrum intake, maybe also sow vaccination against Clostridia, that can be pivotal in controlling coccidiosis in difficult cases, because we know that colostrum can have a positive impact on the outcome of infection. And also, regular reevaluation of the status in a herd should be done to monitor sustained control. And it's not as difficult as it may seem, and it's easily achieved. And I think we should look from time to time whether our measures are still in place and are still working.